Hello guys, my name is Ali. I'm a medical doctor, and in this YouTube channel I'm gonna teach you guys different subjects such as physiology. And I appreciate if you guys share my videos to your friends, subscribe to my channel, and let me know about the quality of my videos in the comment section. Thank you very much, and let's start. Hello and hello again, and let's start with the physiology of heart, which is my first video. I hope you guys enjoy it. So first I'm gonna talk about the impulse generation inside the heart. So to pump blood into our vessels, our body, our heart need two different type of systems. First, we need some muscle to contract, and we need some system to make it regular, so it happen every second, every like microsecond, I don't know how they call it. So for this reason, we have this kind of cell which we call it conductive cell. They are in the same in some type of tissue, as it has different part. For example, the first part is SA node. SA node is the one that make these pulses the fastest. So they generate around 100 pulses in 1 minute. Then we have AV node. So from the SA node, it goes to atrium, and they contract the muscle here. Then they go to the AV node, and then we go to the bundle of His. In AV node and bundle of His, the rate would be a bit slower, which is 40 to 60 per minute, like 40 to 60 pulses per minute. And then between the wall of the ventricles, we have the bundle of His, like the branches, right and left. And then it goes to the Purkinje fibers. These Purkinje fibers go all through the ventricular muscles in both sides of the heart, and they go up to the point that there is a wall between the atrium and ventricle. So if they ask you where they finish these pulses, you have to say like in the wall of the atrium and ventricle, like here. And some points to memorize it better: in some diseases there is a defect in this wall, and these pulses can go back to the atrium, so they cause some problems. You guys studied them in the pathology. So let's go and talk about SA node in more detail. So SA node actually is lateral to the inlet of the superior vena cava in the right atrium. So this is in the right atrium. This is very important to know first. And they, as I mentioned, they rapidly spread this potential and these pulses. So the other important factor that you need to know is the action potential. What is action potential? Action potential, we have it everywhere. You guys probably know it from the high school, from your college, that for example in nerves, sodium comes inside the cell and potassium goes out. They cause depolarization and repolarization. The same things happen in nodes, in like these conducting cells, but like they are a bit different, that we're gonna talk about it. So mechanism of pacemaker potential, the action potential that I talked about. So there is one graph that you shouldn't mix it up with other graph. We have like same kind of graph for nerves, for muscle, for skeletal muscle, for cardiac muscle, that they are different from this one. Why they are different? Like the type of channel that they have, the mechanism of their job is different. So their graph is different, and you have to know it by heart, and don't mix it up. Please don't mix it up with other type of graph that is same as this one. Like, I mean a bit same as this one. So this one presenting SA node. So this graph presenting SA node. And as you see, it has 4 different parts. Like this part, we call it hyper polarization. So they how they work, we have a kind of like current, this I representative of current, and we call it phonic current. Phonic current. So this phonic current, they have like so-called HCN channels. I wrote the name here: hyperpolarized activated cyclic nucleotide gated cations. Probably you don't need to know the full name, but it's better to know it. Maybe your examiner want to know more. So how they work? They are actually prepotential. We need to arrive at the some threshold. Doesn't matter what kind of action potential. In every action potential, we need to like reach the same, like some threshold to have the depolarization and repolarization. Let me give you an example. For example, if I touch my hand, if it's like very, like I touch it like this and I close my eyes, I might not like realize that I touch my hand, because like this threshold will not reach by like very small stimulation. So this is threshold that I'm talking about. So let's go through the different stages. We have hyperpolarization. So sodium ion will go through the HCN channels from outside the cell to the inside the cells, like we talk about the nodes. From the outside the conducting cells to the inside the conducting cells. And it's supposed to be less than -50, like around -60, to like these things happen. And when from -50, this like funny currents work by like pushing Na inside the cell, they slowly start to depolarizing, like we call it hyperpolarization. And one important like just fact that's if you tell it to your examiner, they will really enjoy it, is like a drug called ivabradine, that they can inhibit these channels. So when they inhibit these channels, they don't let this action potential started. So we don't have any depolarization. If there is no depolarization in SA nodes, no contraction. So heart rate stay low. So another important factor that you need to know about these HCN channels is that they have HCN like type 4 and 1. They are non-selective. What does it mean when we say non-selective? When we say non-selective, it means like it doesn't matter on the type of the ions that want to come into the cell or outside the cell. But here we have sodium, so sodium will go inside the cell, but they are non-selective. And the things that can cause this transportation happen is CAMP. CAMP, as you know, as you remember from like lectures in like the beginning of your physiology, CAMP start to active by GS, like G protein, G coupled protein, and they directly bind to these channels, and they will push the sodium inside the cell. So now we know about the first stage, from here to here. So if they ask from here to here, sodium, HCN channel, they reach the threshold, and then the real things will start. So initiation of depolarization. Initiation of depolarization from pre-potential to the like action potential. It's happened when like from the -50, it's gonna reach to -40. So from -50 reach to -40. This happened by T-type voltage dependent calcium channel. Voltage dependent is type of the channel. So we have different type of channel, as you guys study in your previous lectures in physiology. So this type is voltage dependent calcium channel. They are T-type, and they mainly calcium. So this is something important, that you know that they are mainly calcium, but sodium can go as well. And they reach from -50 to -40. And they initiate depolarization. After that, when the depolarization initiate, they have to go all the way up. To going all the way up, what do we need? We need some other type of channel. We call it L-type voltage dependent calcium channels. So this type of channels from -40 comes to like somewhere around -25, and at this point it's like sorry, my mistake. They start to open at -25. So when they reach -25, they start to work this L-type channel, and at -25, this T-type, which initiate the depolarization, will not work anymore. They stop working. So if you ask me, how should I memorize this thing? How should I remember which one is first, which one is second, like T-type, L-type? You have to know first teachers enter the room, then the lecture will start. So T teachers, L lectures. So first T type, then L type. And after that, when they reached like some level and they did their like the polarization and they sent the signals, like they say, yeah, we arrived, then they have to go to the rest again, like they have to go into the resting situation, like at minus 60 again, for like going to the rest for next sentence and for next pulse generation. So this happened by two different type of channels, like they are using same, I mean like not two different, they have various type. So from here to here they use different type of potassium channel. They are also voltage gated, so this is important to know. As you see, like in the fourth stage they are still voltage gated, but this time potassium, but this potassium will not go inside the cell, they go outside the cell. So they have the positive, they have the positive ion, they are a positive ion, and if they go from inside the cell to the outside the cell, inside the cell becomes more negative and the repolarization will happen, so they go out. But you have to know this voltage gated, which is still here, they are different type. But like from here to here there is another type that they cause hyper-repolarization. This type is potassium channel as well, and they do the same thing, but like they depended on the acetylcholine. So what is acetylcholine? The acetylcholine is a neurotransmitter that they are in the parasympathetic nervous system. And here what's happening exactly, vagus nerve, which is part of our parasympathetic system, they send signals. They send signals and they say, okay, go from minus 40 to minus 60 to be more relaxed. You know, parasympathetic works for the relaxation of our body. You eat, you want to sleep, that's parasympathetic. So from here to here, when they want to work, they use this acetylcholine, and they have a name called GIRK, like 1 and 4 channel, and they do the hyperrepolarization. So now that we know how they work, we have to also know that there is a system that they can affect these action potentials. How they can affect it? By sympathetic, which active our body, and parasympathetic, which like relax our body. So how they work? So first of all, you have to know these two systems, sympathetic, parasympathetic, and they how they act on the slope of prepotential. What was prepotential? This part, the one that like funny channel, like funny current do, like HCN channels. So how they work? They effect on this part and like in the most negative part of our body, as I wrote here, and they affect by funny currents. So I explain all of them. First, let's talk about the sympathetic control of the essay notes. So this is the normal. How was the normal? There was some like slope of like funny current, then depolarization, repolarization, some hyper like repolarization, again like hyperpolarization, then another action potential. So let's see what is the difference with sympathetic. When the sympathetic system affect, as you see, these funny currents opens faster, they like push more sodium inside the cell like faster, they do it faster, and as you see, these signals send faster, and like you see, like it comes here. But like two things happen here. First, the slope, see, like it has some acceleration. You know, you see like here is like the acceleration is more vertical than this one, and the thing is they're hyper repolarizate less than the normal, like, you know, it comes till this level, but this is till this level. So this is the two important things that you know about effect of sympathetic system. How they work? First, they somehow affect on the L-type voltage dependent calcium channels, so they increase the calcium to goes inside the cell, but they mostly affect by norepinephrine, sympathetic norepinephrine. It's something that like everyone's know about. Like when we talk about the sympathetic nervous system, we talk about norepinephrine. Norepinephrine affect on the beta 1 receptors. Beta 1 receptors are the receptors inside our heart, and they active GS, G-coupled protein like GS, and then they make CAMP. They increase the CAMP, the CAMP increase, and they activate HCN. As we mentioned in our previous slide, that HCN will directly bind CAMP, and we call it positive chronotropic rate. They increase the heart rate by this mechanism. So pulses will increase, heart rate will increase. So now let's talk about the parasympathetic. Parasympathetic actually is opposite than what we explained. I already explained about the vagus nerve. You have to know that right vagus nerve goes to the SA node. This is so important. So everything that happened with our SA node is by right vagus. Right atrium, right vagus, they have the same effect. Then the left vagus nerve goes to the AV node, but like AV node has the slower conduction. So this is the more important one, especially in your physiology exam. So how they work? As you see here, in the normal cell, we have hyperpolarization, action potential, and then hyperrepolarization, and this goes like all the way. So let's go to see how this parasympathetic, the one that I draw in black. So I already explained that everything that happened with control of pacemaker will mostly affect the slope of prepotential, this funny current. So how they actually work? CAMP goes up, funny current act more. It's the same way. Look, so acetylcholine can affect on what? M2 receptor inside our heart. M2 receptor, what they do, they affect on G-coupled I, like the A inhibitor. And when they activate G-coupled I proteins, what's gonna happen? CAMP will decrease. CAMP decrease, what happened? Funny current decrease. And we have to also know that calcium channel also decrease, and permeability of the potassium, which can cause hyperpolarization, will increase. And they have a negative chronotropic rate. So what's gonna happen by the end of affecting parasympathetic control? Negative chronotropic rate. We have a negative chronotropic rate. So these are the two most important things that you need to know. So now we already know about like how this sympathetic and parasympathetic work. So you have to know that these nodes will have a balance. This balance is by the parasympathetic and sympathetic. However, you have to know blocking parasympathetic effect is like much more than sympathetic effect. If I want to explain you, I'm going to explain it with two drugs. Propranolol, you guys probably are like all the medical students know this drug very well since the first day of the school. So propranolol actually inhibit the beta 1 receptor. What was beta 1 receptor? A receptor of sympathetic nervous system. So they decrease the heart rate by 10 beats per minute. However, atropine, which can inhibit M2 receptor. M2 receptor is the receptor of parasympathetic nervous system, and they decrease the heart rate by 50 times, like 50 beats per minute. And why is that? For example, I want to give you an example of like a case. When a patient come to the hospital with like severe tachycardia means like high heart rate, they give them atropine to decrease his heart rate very fast. So when it's something very acute, they don't give propranolol. Propranolol, they usually give it, for example, if they want to keep the heart rate a bit down in a long-term course. But like once they want to do something very fast, they use this atropine. So and now we know about the physiology. Let's talk a bit more about like pathology. It's like physiology related that you guys need to know it for your exam. And if you tell it to your examiner, they're gonna love it. So what happens if a SA node doesn't work? Next, if the SA node doesn't work, the next conductive tissue will do the job. But like which one and how? The important about SA node is this HCN channel. So what makes SA nodes different, having different action potential than other type of action potential, such as like in the nerve, in the muscle, is this one, the HCN channel. So all these conducting cell, they have it. But like we have different nodes and different conductive cells and tissue inside our heart. Which one will take the job? The first one that will take the job with the highest pre-potential slope. You guys remember I speak about the pre-potential slope, and the one with the highest pre-potential will get the job. So, but you have to know, the boss, the real king is SA node. When SA node's working, they suppress all the other conductive cells. They say, I am the boss, I'll do the job. So in case of SA node death, the king will die, the next highest pre-potential slope take the job. So, and this one is really important. Please memorize it. Please memorize it. And it's not something weird. This is exactly on the order of the pathways. So if we want to go from the fastest to slowest frequency, first it's AV node, then it's bundle of His, then is the bundle branches, then Purkinje fibers, and then ectopic cells. What is ectopic cells? There are some kind of cells that is not in part of any of these systems, but like they are conducting cell and inside the heart. So this is ectopic. And that's it. I hope you guys enjoy it.